Hello, my name is Maja Cikes and I come from the University Hospital Center in Zagreb in Croatia. The responder group findings over the 2-year follow-up period were actually quite confirmative of the data that we know so far and actually very much establishing this therapy as something we should look into. It gives us a very good insight into the safety profile of this treatment, which is very good, but also of the efficacy of the treatment, mainly highlighting the reduction in heart failure events, but also what is important for our patients, their quality of life and symptoms. We have data really to strongly believe and that supports the fact that this subgroup is real. This is partly a phenotype of the wider HFpEF cohort where we do see a clear reduction of events. For instance, if we look at heart failure events specifically, we see that in the overall population, there is no specific difference between the sham and the shunt group, while in the responder group, this data clearly evidences a reduction in heart failure hospitalization events, which is, of course, very important to us. They strengthen the data that we've seen so far in the 1-year follow-up data set. We see a continuation of the reduction in the heart failure events. We see clinical benefit to our patients. They don't necessarily want to hear that there will be a reduction in heart failure events. What is much closer to them to understand is that there is an improvement in their quality of life and amount of symptoms over the time. And this is indeed corroborated by these data. Partly, what is important to us as physicians, really the continuous reduction of heart failure events, and already some of the data that we have collected over the 3-year time period corroborate this as well. It seems very well that this is sustained over time, so this sustained effect is very important. And again, the thought that we can offer to our patients in the sense of improved quality of life, I think is very meaningful. What we always debate about in HFpEF is really the heterogeneity of this syndrome. So even within the patients that were clearly attributed to the reduced SLAP trials, even there we see that there is a specific cohort, a specific phenotype within them that are the responders as we define them today. These are patients with pulmonary vascular resistance at peak exercise lower than 1.74 Wood units. These are patients without pacemaker leads. So really very detailed phenotyping is becoming more and more important in this broad syndrome, and this is one of the ways to confirm that. It's important as a trial that is really designed towards this responder group. So we have recognized it so far in the data that were extrapolated from the reduced SLAP trials. And now this is a trial that is focusing specifically on these patients. By addressing that, by adequate power, adequate strength to assess outcomes in this dedicated group in a randomized manner, we can really corroborate the data, decide, and ultimately have good evidence, hopefully, that our assumptions so far have been clear and sound.